Hello, this is Grace again. And this part 3. I hope that you had watched this presentation about the recovery after surgery before your surgery. It is also very important that your family and close friends, who will be taking care of you, have also watched this presentation to help you with your recovery. Remember that you can't take care of yourself, especially the first few days after surgery. Your family and friends are important. Having a good recovery depends on being prepared, and part 3 is to help you with a good recovery. Let's begin with, how do I take care of my incisions and my breasts? Do not smoke or be around a smoker. This can be the most significant cause of serious healing issues. Despite the multiple layers of sutures closing your incisions, there will be some oozing of tissue fluid from them for several days after surgery. This will soak up on the gauze and the bra to look like more than it really is. This is normal. Starting the next day after your surgery, you can take a shower. A daily shower will help your breasts to be clean and your incisions to heal. Use a gentle soap such as baby soap. Pat dry the breasts and the incisions. Do not rub the incision. Keep steri strips on until they start to curl up on the ends, and then gently remove them in the shower. If your incision was closed with skin glue, it will slowly flake off over the first couple of weeks. Once the steri strips are off, it is important to keep all the incisions clean without crusts and scabs. Concentrate in the shower to clean the incisions. You can apply topical antibiotic ointment for a few weeks after surgery. Your scars will start out flat, but will become red and thick, for 6 to 12 months. This is normal. In time, the scars will soften and fade. We suggest you can control the healing process of the scar starting 3 weeks after surgery by using a silicone gel tape on the incisions. This will help support the incision, control the scar and protect the incision from sun exposure. Wear the silicone tape 24/7 for a minimum of 6 to 12 months after surgery. If your breast skin is dry after surgery, you can apply a moisturizer several times a day to help support your breast as it heals. Wear your surgical bra 24 hours, 7 days a week as directed for 6 weeks after surgery to support your breasts. Your surgeon may let you move into a sports bra after 2 weeks. The bra needs to be a front closure with formed cups, not flat front. Avoid bras with stays and underwires for 3 months. You may pad the incisions with gauze for comfort. The surgical team may modify the instructions when you meet with them after surgery. The next question is, what should my activity level be? The evening of after surgery, it is important that you exercise your calf muscles to prevent blood clots. The morning after your surgery, sit in a chair and start walking every few hours. Do not remain in bed. Activity will help reduce swelling, lower the chance of developing blood clots, pneumonia, and avoid constipation. 3 days after surgery, slowly start arm and shoulder range of motion exercises 4 times a day. This will help you regain your mobility. After 2 weeks, you may begin to drive as long as you have full range of motion with your arms, and can stop the car or swerve in an emergency. You must not be on any pain medications except ibuprofen or acetaminophen. After 2 weeks, you may perform light lower body exercise but must wait the full 6 weeks prior to performing upper body exercises. You must avoid more vigorous activities that include household duties, exercise or work duties that require lifting and physical effort. After 4 weeks, you can gradually begin more vigorous physical activities that include working out, sports, returning fully to work without restrictions. After 6 weeks, you should be fully recovered. The next question is, how do I manage my pain and discomfort after surgery? It is not possible or safe to eliminate all pain. It can be reduced to a tolerable level. Stay on top of the pain, especially the first few days after surgery. Do not allow the pain to become out of control. Alternate ibuprofen and acetaminophen so you are taking a pain medication every 3 hours, especially the first 3 days after surgery. Ibuprofen is taken every 6 hours. Acetaminophen is taken every 6 hours. So, if stagger both medications, you can safely alternate between the 2 medications every 3 hours. Follow the dosage on the medication label and take the pain medication with food. For adults you can take up to 600 mg ibuprofen. For acetaminophen you can take up to 1000 mg. Sometimes in the evening the pain can be more severe and you have difficulty sleeping, then use the prescribed narcotic or narcotic-like pain reliever to take away severe pain. You should not need this beyond the first 2 to 3 days after surgery. Remember that the narcotic can cause nausea, vomiting and constipation, so it is best to limit its use. After the first few days, you should be able to decrease the dosage and how frequently you need to take ibuprofen or acetaminophen. By the second week after surgery, you should only need the occasional pain medication. This is a sample pain management regimen to help you understand a good way to control pain and discomfort. You can change the timetable to better suit your needs. The first 3 days at home, alternate the ibuprofen with acetaminophen every 3 hours. 6 a.m. ibuprofen 400 to 600 mg, 2 to 3 200 mg capsules. Then 3 hours later at 9 a.m. you can take extra strength acetaminophen 1000 mg, 2 500 mg tablets. 3 hours later at 12 noon you can take ibuprofen 400 to 600 mg, 2 to 3 200 mg capsules. 3 hours afterwards at 3 p.m. you can take extra strength acetaminophen 1000 mg, 2 500 mg tablets. 3 hours at 6 p.m. you can take ibuprofen 400 to 600 mg, 2 to 3 200 mg capsules. Then at 9 p.m. you can take acetaminophen or a narcotic if needed to help you sleep. After the first 3 days, narcotic should be minimal or none. Use only ibuprofen and acetaminophen as you need it. Next question often asked is, how will my breasts feel after surgery? You may not have normal sensation in the nipples. This may be more or less than usual, and usually returns over a couple of months. Your first menstruation following surgery may cause your breasts to swell and hurt. You may have random, shooting pains, tingling, or other strange sensations in the skin for a few months. These will subside. Most of the discoloration and swelling will subside in 2 to 4 weeks. Your breasts will feel firm to the touch initially, but will soften with time. A more natural shape will occur as the breasts settle in a slightly lower position over the first few months. Scars may be red and thick for 6 to 12 months. In time, these usually soften and fade. You can use silicone tape to help with the scar healing. It is important to remember that if any revision is needed, this is best considered 8 to 12 months after surgery. When should I reach out to my nurse and doctor? If you have increased swelling or bruising, particularly one side greater than the other. If swelling and redness persist for a few days. If you have increased redness along the incision. If you have severe or increased pain not relieved by medication. If you have any side effects to medications, such as rash, nausea, headache, vomiting or constipation. If you have an oral temperature over 100.4 degrees. If you have any yellowish or greenish drainage from the incisions or notice a foul odor. If you have bleeding from the incisions that is difficult to control with light pressure. If you have loss of feeling or motion. Finally, if you have any other unanswered concern, please reach out to us. When are my follow-up appointments after surgery? Your first appointment will be 1 to 2 weeks after surgery to see our advanced practice nurse and doctor. Thereafter, follow-up appointments will be arranged depending on how you are healing and how comfortable you are with caring for yourself. The first 6 weeks after surgery are the most important. It is critical that you do not schedule important events or plan for being out of town for this first 6 weeks after surgery. Most of the problems with healing occur during this early phase of recovery, and when we have the ability to intervene to improve the outcome. We want to thank you for watching this presentation. Please be sure to watch Part 2 and Part 3 if you are considering breast reduction. We look forward to taking care of you. If you are a new patient, and after watching all of our presentations on breast reduction, you have decided you are interested in pursuing the procedure, please make an appointment as a new patient by calling the main number at area code 312-355-4300. Please make sure you have read all of the information and brought in all of the requested records from your primary care doctor. Please do not make an appointment without having all the information we need from your primary care doctor at your first appointment. Please review Part 1 again to remember what is needed. After your first in-person appointment, our staff will help you set up an account with the University of Illinois Health MyChart for all further communications. If you are a returning or established patient, the best way is to contact us is, not by calling us, but using University of Illinois Health MyChart. You can text us questions, and we can then reply in writing so that we can keep track of your care. Please use University of Illinois Health MyChart for all communication. You should download the app to your smartphone. Our team of plastic and cosmetic surgeons at the University of Illinois can offer a wide range of plastic, reconstructive and cosmetic procedures. Please take the time to explore the information we have on our website and discuss with your plastic surgeon other procedures you might be interested in. This series of presentations on breast reduction were written, directed and produced by Dr. Patel. Sound recording was at Beechwood Studios. Vince Mann of Globetown Media did the final editing. This series is copyrighted 2022 with all rights reserved by the Division of Plastic Surgery at the University of Illinois at Chicago. My name is Penelope Johnson, and I play the part of Grace. Dr. Patel, thank you for giving me this role, and I hope that your patients will find it useful to make such an important decision to better their health. It was a lot of fun, and I too learned a lot. I look forward to working with you again.